Welcome to the Fed to Fed podcast, where we dive into the dynamic world of government technology. In today's episode, we focus on innovations in federal health IT with a Digital Health Transformation Award honoree. These programs fearlessly embrace the revolutionary potential of emerging technologies to redefine the landscape of federal health IT. We'll dive into how these visionary programs and teams drive positive transformation and push the boundaries of what's possible. Jason, Kelly, thank you so much for joining us today.
Thanks for having us. We appreciate it.
Thank you.
You bet. Well, why don't we go ahead and dive right in? And I'd love for you to take this opportunity to share an overview of your program and the innovation you've developed to meet the mission.
Yes, ma'am. I'll take the first question. So thanks again for having us. And just a little background for our introduction is, Kelly and I are assigned within the Veterans Health Administration, and that's better known as VHA. And we're within the Office of Integrated Veteran Care. And IVC is really a fairly new office within VHA. We were established in mid of 2022 when the Office of Community Care and Office of Veterans Access merged. Essentially, it brought together direct care and community care into one main program office. And now this program office integration really assisted VA by creating a model that focused on bringing veterans the soonest and best care. And that's for both direct VA care when veterans go to a VA clinic or hospital, and for our veterans who seek care in the community for all their medical needs. IVC's mission is twofold. And similar to what I previously discussed, IVC and our teams really focus on enabling veteran access to the soonest and best care. And we also ensure that every veteran and qualified beneficiary have access to high-valued care when and where they need it. Within IVC, we have where Kelly and I work, integrated informatics and analytics, and our team provides tools to assist and support leadership to make informed, data-driven decisions, both at the analyst and leadership levels. This initiative we're going to talk about today, we're really excited to talk about this, is the IIA Predictive Modeling System. And really what the modeling system does is it enhances IIA, or informatics, and IVC's analytical abilities to examine what a patient is seeking care for in VA, and uses recent innovations such as explainable AI to uncover comprehensive insights for care, really improving a veteran's personal care needs. But it also identifies support needs for veterans we care for, because as Kelly and I both are veterans, we really want every opportunity for veterans to be cared for, and we're very passionate about that. So just in a little bit more, we're grateful for the efforts we're recognized for by your team in the Digital Health Transformation Award, but also excited to discuss a little bit more how we can leverage technology to enhance veterans management of care. So an overview of the program and some of the innovation items we've worked on is our predictive modeling can identify veterans who are at high risk for a variety of healthcare concerns. Ideally, we're looking at chronic disease progression and emergency department utilization. And the models identify key factors to contribute to a veteran's increased risk for negative outcomes. So empowered with this type of data, clinicians and VA leaders can really improve care management by intervening early and tailor care for high-risk individuals and their cohorts. Our team, we really aim to enhance veteran experiences and outcomes, their access to care through actionable, high-quality insights. Our mission in IVC and IIA is to provide VHA leadership with the tools and data necessary so they can really make informed decisions based on that data-driven outcome we provide to them. So to achieve this, we really set ambitious goals that include the establishment of advanced modeling capabilities for forecasting healthcare needs, but also look at how we can deliver predictive analytical solutions to proactively address veteran healthcare. One of our solutions we've talked about just a second ago, the IIA Predictive Modeling System, it really delivers a sophisticated predictive analytical tool that leverages cutting edge research by deeply assembling learning and expandable AI in partnership with IBC's clinical expertise. We have a lot of great doctors at VA. So explainable AI, and what that refers to is an AI system that's designed to make decisions and processes transparent, interpretable, and understandable. It really helps build trust and ensures that we're fair and meet ethical and regulatory requirements by providing clear explanations for AI outcomes. The IIA Predictive Modeling Project was led primarily by our smart supervisor here on the call today, Kelly Kukowski, but Mary Fields, who's our informatics executive director, and I really assisted in project management oversight for the project. Kelly, and in partnership with our savvy and smart senior data science professionals, really assisted in driving home this project by providing actionable clinical insights under the highest standards of equity, equality, safety, transparency, just everything for the system. So for a little bit more, I'm going to pass it over for the project inspiration to Kelly, and she can help expound on that. Kelly?
Yes, thank you, Jason. Our inspiration for this project is VA. We're the largest healthcare system in the world, and we have a lot of data. And we report on so many different things, but we want to take this to the next step so that we're actually providing data, actionable data, down to the veteran level. So we want to be able to give this data to our healthcare professionals, and so they can tailor a plan down to a veteran or a cohort of veterans so that they can provide a better outcome for our veterans. We all are looking at veterans that, like Jason said, emergency room utilization or a specific disease cohort, so that we, again, can improve our healthcare outcomes of our veterans. We realize that our data is an asset. And so by starting to use this AI technology, I mean, it is fun, it is new, but you have to be smart about this so that you can build that trust. Our healthcare clinicians might not have seen a tool like this before, so we have to make sure that we are transparent with them and how we are able to take all of this data and provide it to them so that they can get down to that veteran or disease cohort level to make these decisions. We have the two frameworks that Jason talked about, our ED modeling and our disease progression modeling, and both of them are going to be flexible and adaptable so that our physicians are going to be able to use this tool to treat their veteran or treat a cohort and make some actionable decisions for them, so that they are getting that soonest and best care that our veterans deserve. You had also asked us to look at our challenges, our unique challenges with this. Again, AI is new for VA. And again, we report on a lot of data, but we want it to go that next step to be actionable. And so we are working with data scientists, we are working with data engineers, and you that have that experience with this AI, they know what to look for with our machine learning, such as the data bias, the fairness. We want to make sure that we're capturing all of that information so that we're not missing a demographic or missing a certain population of veterans, so that these decisions that are being made can expand to all groups of our veterans, whether it's an age related, a demographic related, or a disease related type of treatment plan that that veteran might need. And so I've been learning a lot of this AI along with the team that we collaborate with in building this. And it is a slow process to understand. And I feel like that challenge is I have to educate myself so that I am able to speak to it to everybody else, because eventually we're going to need to share this with our VA providers so that they can share this with the veterans that they are treating in their clinics.
That's wonderful, Kelly. Thank you so much for providing that information and certainly cutting edge in terms of what's happening to provide that access to that data in a very actionable way. So, looking ahead, what does the future of this program hold? And how do you plan to continue driving innovation and ensuring its success in meeting evolving needs?
Sure, I can take that, Susan. Thank you. So looking to the future, informatics is really looking to have predictive modeling efforts centered on expanding our ability to leverage advanced predictive analytics and ultimately enhance our veterans' medical care. We've established a strong foundation for responsible AI. Now we want to continue to use it. There's a lot of good AI out there, but one of our short-term goals is to pilot this product further in order to refine and to continue to inform our efforts using real-world evidence-based data. We want to hope to consider also additional high-impact use cases as we move forward to apply our comprehensive and flexible modeling system to diverse conditions and help veteran health outcomes. We also want to aim to build stronger partnerships. We want to be collaborative in VA with other clinical subject matter experts and other leaders across VA to further inform them of the system and expand the tool. The system's huge and it's a huge success. We want to make sure that all of our efforts are recognized by the teams that have done a lot of hard work here. Thank you.
Excellent. Thank you so much. So, with these programs, there are lessons learned throughout this journey as you're getting started in the space. What advice would you give others seeking to bring similar innovations to their organizations?
I will take this one. So many lessons have been learned, and I do have advice that I would give to others if they are interested in pursuing a similar process. We learned early on to collaborate with our data engineers, our data scientists, and meetings. We have had so many meetings, and again, learning AI from the beginning and building on that, I am not afraid to ask questions. And it might just be the most simplest questions, but these scientists and engineers have been very patient with me. And so I consult and I know where the data is in the VA, but they know all the other machine learning pieces of it. That collaboration has been so helpful to build the trust so that they know I know where that data is and I know what the data needs are and they know how to put it all together. They are the ones that have had to explain to me about the data bias, the fairness, all of that equity to just make sure that these cohorts of veterans that we're looking at is applicable across our entire scheme of veteran population. The transparency and trust that we have as a team is another lesson that we have learned. And you also have to be adaptable. We learned to just start small with our original project and then expand on it because that AI technology, it can take millions and millions of rows of data and put an output together that you're just surprised by what it does. Advice that I would give other people, going back to our original discussion points, VA has a mission, and we wanted to make sure that this project was in line with our mission and having our veterans have access to the soonest and best care. And so we use that to just start our framework for this project. And again, we encourage collaboration with the people that know the data, the people that are trained on how to use that AI and bring it all together for this project. And know that there's going to be several iterations of your project. Maybe something isn't going to work and you have to step back one or two steps, but it does move forward fairly quickly. And measure your impact and ensure that the information, the testing, user acceptance testing is also completed. And then we are sharing this with a small group before we expand, obviously, to the rest of our VHA partners.
That's very exciting. Jason, do you have anything to add to that?
I would just say, listen to your subject matter experts. As from a project management oversight perspective, they know what they're doing. and carefully aligning those innovations to, like Kelly said, the start of the mission, I think is crucial for any organization to make sure that the mission, the values, and those emerging priorities of an organization are met.
That's excellent. Well, I would like to thank you both for this great discussion. I can't wait to see where it goes. Thank you so much for your commitment to the mission, commitment and passion for the work that you all are doing and pulling these incredible teams together and your vision to see and talk about what success looks like. So I'm looking forward to engaging again to hear how the pilot is going and how it's expanded over time.
Thank you, man. Appreciate your time today.
Thank you, Kelly. Thank you, Jason. This concludes today's episode of the Fed to Fed podcast. If you enjoyed this episode, please don't forget to subscribe, rate, and leave a review. Your feedback helps us continue bringing you thought-provoking conversations with the brightest minds in government technology. Stay tuned for our next episode, where we will continue to explore opportunities to harness the power of technology and explore what's next in developing a more innovative and efficient government. Until then, this is the Fed to Fed podcast by GovTech Connects. Thank you for joining us.